Have you been told in the hospital that you have blocked tubes and you're wondering what to do, if there's any cure for you, if there's any medication to help you with these blocked tubes? This video is for you. We're going to be talking about what causes blocked tubes, what are the types of blocked tubes, and how can we treat these blocked tubes, and what are your chances of getting pregnant after the treatment. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. And if these are the kind of contents you like to watch, why not subscribe to this channel so that you don't miss out on any video. Let's dive right in. What is the fallopian tube? The fallopian tube is that tiny tube that connects the womb to the ovaries. Now, when the egg is being released from the ovaries, it passes through this tiny tube called the fallopian tube into the womb. If it is blocked, it means that the sperm and the eggs are not going to meet. What are the most common causes of blocked fallopian tube? First cause of a blocked fallopian tube: sexually transmitted infections. That's chlamydia, gonorrhea. They have a high affinity for the tubes. Once you are infected with chlamydia, gonorrhea, it's like there's one place that they are looking for, is for the tubes. And once they go there, what do? It's just like you having a wound or an infection. It causes a scar there, it causes a wound. And when the wound heals, what happens? A scar is formed, tissues are formed, with tubes are blocked with this scar which have been formed. So you see that once you have this infection, it can even be a present infection at that time, or even a long-standing infection, and it was not treated. Then it stayed there and it caused the blockage of this tube, and you do not know. Maybe it was now when you're trying to get pregnant and you're not able to get pregnant. That is when they start checking and seeing that your tubes were blocked. Now, there are other causes of blocked tubes like endometriosis. Endometriosis means that there are places in the womb where menstruation occurs, which it does not have to occur there. Fibroids, it can be at the level of the tubes, and it blocks the tubes, it blocks that egg from reaching the sperm. So in this case, you have seen that it is actually blocked. If you've had an ectopic pregnancy before, and they go and maybe they don't remove the tube, they just went and removed the ectopic at that time, so you might have had a surgery at that point, and it can form a scar too and block that fallopian tube. So what are the various types of blocked fallopian tube? We have the distal blockage, the mid-segment blockage, and the proximal blockage. So most of the times for the distal blockage, it means that it blocks at the end towards the ovaries. Once it's blocked there, it's mostly due to hydrosalpines, and hydrosalpines are mostly from infections, from sexually transmitted infections like chlamydia and gonorrhea. It can cause like a collection of fluid at that level, so causing the blockage of the tube. Then mid-segment is when we have, for example, like bilateral tubal ligation. That's in women, for example, who have crossed 35 years old and they have had their number of pregnancies and they don't want to get pregnant again. That's what we call the permanent sterilization method for women. But at times you can see a woman who has had these blocked tubes and still wants to get pregnant, and or gets pregnant even after a blocked tube. Now, the proximal blockage is usually due to infections, such as infections after a miscarriage, after an abortion. You know, when you have an abortion, it can lead to infections. That's septic abortion, where maybe it's not treated properly or the procedure is not well done. It becomes infected. The bacteria from your vagina can migrate into the womb and go and block the tubes just at the beginning of the tube. So infections from a miscarriage, infections from an abortion, even infections from a cesarean section, those are where blockage can occur. And also still from sexually transmitted infections like chlamydia and gonorrhea. How can you diagnose blocked tubes? There are various methods in which a blocked tubes can be diagnosed using a special X-ray called hysterosalpingography, that's HSG, where a dye is sent in through the vagina into the woman's womb and through the fallopian tube. So as the dye is going through, they are taking series of X-rays, and once they see that the dye actually passes through the tubes, then it means that the tubes are patent. But if it doesn't pass, it actually tells you where the blockage is found and if it is partial or it is complete blockage. There are other methods like an ultrasound scan tool can be used. They might see a fibroid which is so large and around the tubes, blocking the tubes. Endometriosis, you can see swellings of the womb which has actually extended to the level of the tubes and causing blockage of these tubes. Now, other things, we have what we call exploratory laparoscopy surgery or hysteroscopy. So these are just when you just get in, they use a small camera and it's inserted into the abdomen, and the view, maybe they see that okay, these tubes are actually bent and they try to release it. And also hysteroscopy, they send the camera from the vagina into the womb and maybe using some fluid to actually open the womb. So with all these are some kind of techniques in which you can diagnose the blockage. So once you have this blockage, what can be done? How can it be treated? The first thing, like I said, the first common cause is infection. So sexually transmitted infection, it should be properly treated. The woman and her partner and even her partners should be treated for this sexually transmitted infection with antibiotics. So sometimes you might treat this infection and you get pregnant immediately. Now there are other ones where it has caused a lot of adhesions, tight adhesions, tight fibroids and scar tissue, so they can go in with what we call either an open surgery or a laparoscopic surgery. That's, you just use like a camera and you just use some tubes and they check inside the abdomen and they release those fibroids. For example, if you have your tubes which are usually straight as this, then maybe it can be bent due to an infection around here. So with this laparoscopic surgery, they can go and release these fibroids which has caused the kinking of the fallopian tube and make it now to become straight. So it depends on what is seen in there. Sometimes too, in infections where it affects the womb inside, what do? They do this what we call exploratory hysteroscopy. Hysteroscopy means they take a tube too and send from inside through the vagina into the womb and actually try to separate. And sometimes, like there's what we call complications from abortion, from section, if it is not properly done, Shaman syndrome, where the womb tends to join together and it means that the womb is not open. So they can use this kind of technique, hysteroscopy, to actually go in and it opens the womb and makes pregnancy to be possible. Now, sometimes they might go in and these scar tissues are so many and maybe too tight in a way that maybe more cannot be done. So in that case, what do? They might just try to release it as much as they can. But in cases where it's actually blocked and nothing can be done, the other method in order for you to get pregnant is through artificial methods of getting pregnant, like the in vitro fertilization, where they are going to remove your egg and take the sperm of the man and fertilize it and then insert it into the woman. That's in vitro fertilization. So once there is no way, but sometimes some women actually sometimes they can stay like this and maybe the tube just gets released, gets open, and they get pregnant even naturally. Once you've been treated for this and maybe your options of fertility are given, then you can go ahead. And if maybe there's no way, then they can go in, they can advise you on an in vitro fertilization. So these are the common methods of treatment. Infection, you treat with the corresponding antibiotics. If you need surgery, you can do an open surgery or a laparoscopic surgery, but most of the time laparoscopic surgery is always advised. Then if the adhesion cannot really be released totally, you are also advised to do an in vitro fertilization in order to get pregnant. Still, make sure that you should know that there are other causes of infertility. So maybe it might be, for example, if it's a partial blocked tube or the tubes are not really damaged, know that there are other causes of infertility and you are treated according to the cause of your own fertility. So if this was helpful, please give a thumbs up to our video, and don't forget to subscribe and share this video to other women out there. And if you want to have a private consultation or private chat with me, click on the link below and give me a call, either a video or an audio call, and you will get to me. God bless you.